information that we are sharing today is our own personal experience and does not constitute as medical advice. We do not endorse any products or services. Any said products or services mentioned on this podcast may not be suited for you or your condition. Please consult your physician before making any medical decision. Today's episode is sponsored by the Wolfen Chair in Digital Health. Recently, very effective drugs called biologics have become available for children with arthritis. If you have undergone JIA treatment, you may have already come across this treatment or have used it yourself. Biologics rapidly stop joint inflammation and prevent joint damage.
Many different biologics are available, each having a specific mechanism to stop arthritis. So that means that patients may have to suffer several months before qualifying to receive an effective biologic medication, as they are required to fail traditional therapies first, which can take several months. This delay causes not only suffering, but potentially permanent damage.
Can Do study, a Canada-Netherlands network in precision medicine in childhood arthritis and rheumatic disease, will allow doctors and families to quickly know, number one, who needs biologics, number two, which biologic works best for the individual child, and number three, when the biologic can be safely stopped.
Canadian and Dutch physician researchers formed an alliance, Can Do, together with patients and industry representatives as well as policymakers, to develop the first genomics-based low-cost biomarker blood test to rapidly identify the best treatment for each individual child, completely transforming the care of childhood arthritis. More about how they want to achieve this will be featured in future episodes.
Hi everyone, welcome back to Take a Pain Check. I am super excited to introduce this week's guest, Ingrid He. She has a JD from Fordham University School of Law, and she's currently a full-time MBA student at the Fordham Gabelli School of Business. Ingrid is the creator of this app, Sjogren's Tracker, a mobile app that kind of helps users track information regarding their symptoms, medications, and comorbidities. So the app was actually first released in the App Store in December 2020 and has already won a second prize in the Fordham Foundry Pitch Challenge, which is so cool, honestly. And Sjogren's Trackers will now be available to even more people with its release in the Google Play Store this summer.
Okay, wow, like you're very busy. First of all. Second of all, how did you have the time to create an app after like you have a JD and you're doing an MBA? Like, how did you have time to create an app on the side?
So I actually was working as an attorney, but I was like feeling sick all the time. I actually took a year off before my full-time MBA program. That's when I started thinking about like what I really wanted to do with my life, wanted to help create something that could benefit others, and what's more relevant than something that could help me as well. So I created something that was tailored to my particular condition, and I called it Sjogren's Tracker. My particular condition happens to be Sjogren's disease.
Oh.
And then after that, I decided to enroll in an MBA program to sort of help me take it off as a business, to learn the business side of things.
Now that I've jumped right to that, we're really happy to have you on today. And so could you start off by introducing yourself and your condition, as we've already spoken about?
Yeah, thank you so much for having me on. So my name is Ingrid He. I practiced as an attorney for about 7 years. I was diagnosed with what is called Sjogren's disease, which is an autoimmune condition. I think it was 2014, but prior to that, I had symptoms for like about 5 years, and I went to different specialists, primary care physicians, and it was just pretty much ignored because they said I was too young to have something serious and that I was probably depressed. So I was referred to a psychiatrist for the longest time. And so finally, I was diagnosed with Sjogren's. So Sjogren's at the time was only known for affecting the dry eyes and dry mouth, for affecting the salivary glands and the tear glands, which is kind of a misinformation because it is a systemic condition. It potentially affects everything. And for me, it affected my stomach, esophageal linings, and the brain, like everything. So a lot of the symptoms are similar with people with different autoimmune conditions, like the fatigue, like the brain fog. So these things are all there. But at the time, it took so long for me to get a diagnosis because I never complained about dry eyes or dry mouth because I was feeling sick all the time. I was having like flu-like symptoms, so I wasn't going to complain about dry eyes.
Yeah.
So yeah.
Wow. That's a lot, because for someone telling you that you're just depressed and putting all those like symptoms or like feelings away, and having like a psychiatrist or a doctor tell you like you're like, I have no idea what this condition is, it's just you're probably depressed. Like, how did you kind of,
Yeah.
when people were telling you that like it's not something that actually reflected your symptoms and how you were feeling?
Um, Honestly, I started to believe it. And I think when you feel sick all the time, when you feel like you have the flu for 3-4 months at a time, you start kind of getting depressed too. And then for the longest time, I thought maybe it was mental, that maybe I was just a hypochondriac, maybe it wasn't anything, maybe if I like, or I was just like a sickly person. I just always don't feel well, but it's nothing that's been discovered. I literally thought I was going crazy. So when I was finally diagnosed by accident, by the way, I felt so vindicated. I felt like, ha, I wasn't imagining all
How
these
was it
symptoms.
an accident?
So I kept on getting sick and kept getting sick. So I basically went back to my primary physician and just had a rant about how I just wasn't feeling well. And then when things are bad, like I would feel my joints would get started to get stiff, and I would feel so tired with the flu-like symptoms. So she thought maybe I had arthritis. So she ordered an ANA. She didn't even think it was what I ended up was diagnosed with. So she ended up ordering a ton of tests, including an ANA, and I was positive for that.
Yeah.
And then she had me tested twice because she said there was a lot of false positives. That I went to then I was referred to a rheumatologist, and it was finally diagnosed.
Wow.
And it was such a weird experience because the rheumatologist was like, I don't want you to worry. It's probably not lupus. It's probably just this other thing. And I was like, what is lupus? I was, I don't know, late 20s. I never heard of autoimmune conditions. It never crossed my mind. I was like Googling all my symptoms, but never once did I think, oh, maybe it was an autoimmune condition.
Yeah. And in that moment, I know like when Natasha and I were diagnosed, we were fairly young. I was 11 and she was 13, and we both have arthritis, so like juvenile idiopathic arthritis. But when we were both diagnosed, in that moment, you're stunned because you're like, this exists. This exists for people my age.
Yeah, exactly. Was it
So,
difficult for you to get a diagnosis as well, or?
I think it took about a year for me to get a diagnosis and be referred to a rheumatologist. I was lucky because my family doctor was really good, and he, like, as soon as I came in twice or three times complaining of that pain, he ran those blood tests right away, and I was lucky in that sense.
I think just having like people around me believe that I was in pain and to take me to the doctor was very difficult. Like, we were just thinking that swollen fingers and stuff like that was just a sprain, so we're kind of pushing it off. But then at one point, like, I kept complaining, and I told my mom, like, my friend's telling me that I should get this checked out. And
Yeah.
then we went to the doctor, and it probably took like 4 months in a way to like actually, or maybe it was actually 3 months. It was not that bad, but I think just getting someone to actually like believe that it was not a sprain was kind of difficult. But it was like not as like, we just got those blood tests done, and then it was like, okay, I'm referring you to a rheumatologist. Also, x-rays was really like a key thing that helped shape my diagnosis. So it was like a swollen finger, and like it was kind of obvious. So we just kept wrapping it around thinking it would go away, and it like didn't go away.
Oh, wow. Yeah, because for
Yeah.
me, there was no sort of physical manifestation. There weren't like all the other blood tests were coming out negative. All the diagnostics were showing normal. And I didn't have like swollen lymph nodes or anything like that, just flu-like symptoms. Oh, it's actually the disease Venus Williams has.
Oh.
Remember when she was in tennis and she like didn't play for a while, but now she's back? Is because she had this.
Yeah. I used to play tennis actually, which is really funny. Like, I stopped playing tennis because of my arthritis. So I think like a lot of people, when they're in a sport and they kind of get diagnosed at that point, or they're having like symptoms, they'll like kind of leave for a while, and then they like slowly get back into it, which I haven't done, but I will do eventually, hopefully. But yeah, so you only had a blood test, which is kind of like your examination to determine like what you had, and then like getting referred to a bunch of different healthcare professionals. So how have your symptoms changed from prior to like the beginning of like that 5 years ago when you were diagnosed to right now?
So it's so strange because my symptoms really didn't fit the whole dry eye and dry mouth narrative. So I, in the beginning, it was definitely affecting my lungs. I would have like randomly just like fluid in my lungs and just cough up phlegm, even though I wasn't sick with anything. And then I would have abdominal pain and things like that. But once I realized it was an autoimmune disorder, I would treat it with prednisone as needed. But nowadays it's more, so nowadays I've just basically become allergic to everything. So I'm allergic to grass, pollen. So basically every time when it comes to March, I start feeling allergies and the allergies trigger a flare and I just get fatigue and brain fog. So now I'm I'm taking allergy shots, hoping that that will take care of that problem.
So how do you manage your symptoms aside from your app? How else are you able to manage them? And how did you manage them before, when you weren't really ready to design something that would help you?
So before I designed anything with the app, I was just taking prednisone whenever I didn't feel well. But that's kind of not good because then it messes with other things in your body and then you get different kind of illness. Because I think I had like other issues from taking too much prednisone. So then my doctor was like, you need to start getting off of that. So then that's when I started to really try to identify triggers to my flares. So one thing that's made a big difference for me is food, is cutting out inflammatory foods. But that's also really, really hard because you basically have to cut out gluten, dairy, and sugar, which are the most delicious things. So I always keep on trying to like see if narrow the triggers, see if maybe I could eat some cheese, but not others. But you know, it's tricky.
Yeah.
So I'm just really trying to identify specific things that make me feel worse so that I could avoid them instead of always turning to prednisone.
Yeah, that's really good though, because the fact that you're trying to, I guess, like, manage your symptoms, like using multiple things is really good because that way you know that, like, obviously with the guidance of your healthcare professional, like
Right.
it's definitely something that you can always like cope with. Because like similarly, even for me, like cutting out some of those like gluten and dairy and stuff has really helped me. But it is very challenging. Like I totally agree with you. It's very
It's so
challenging,
hard.
and I think it's really hard. And I have my mom to cook for me right now, so it's okay. But you know, when I do move out eventually, that'll definitely be a struggle. So yeah.
Going out with friends is hard.
Yeah,
like I cheat on my diet all the time.
Yeah, cheat days, right? Cheat days. It's so funny. Like if you actually like watch a few like some of the episodes, we kind of mentioned like alternatives that I do with my friends, which is like really sad, but we still have fun. But definitely like my birthday, then gotta eat what I gotta eat. Okay, anyways, so we know that you have a huge involvement with the Sjogren's Foundation, is what I've read. How and when did that kind of start, and how did like the foundation kind of help you?
I don't know if it's a huge involvement that they did feature me. I'm trying to get more involved with the foundation because in the very, very beginning, when doctors sort of didn't believe me, and when my first rheumatologist told me that this was just dry eyes and dry mouth, and then I was like, wait a minute, I've been feeling sick this last 5 years. You don't think it's related to this autoimmune condition? And then he was like, well, I could put you on Plaquenil. And that was about it. So when like people didn't really believe my systemic symptoms, Sjogren's Foundation had the best resources that it was a systemic disease that affected other body parts, like even for some people like skin or like stomach, brain, the esophagus linings, because a lot of people with Sjogren's also have GERD, like acid reflux. So that was a resource I would turn to show it to them as a way to sort of give credibility to my complaints. Because when I don't know, sometimes when you're a young woman, they don't always believe you. Yeah. And you can't give random articles. You have to give something from a reputable source.
Right? And I feel like as a young woman, you also don't want to say anything. Like, we're so told that, oh, you should deal with it, that you kind of want to be like, okay, like, I guess I can handle it. It's just a little bit
Yeah, and they always say it's like tricky because they say you look fine, but
Yeah.
I put on makeup to look okay. So I don't want to,
Yeah, but that's when like the invisible disease scenario comes into play.
Yeah.
And like I know like if I ever use like my handicap pass or anything, I get looks all the time when I walk out of my car and they just
Exactly.
don't believe that I should even have it.
Yeah, it sucks. And it's like I could be sick but still want to look nice. Like, do I have to look terrible too? Wow, I feel terrible.
Yeah, I feel like it's always a challenge about that whole like invisible disability. Like you always have to try to like you shouldn't need to explain yourself, but you're always in those instances and situations where you end up having to explain yourself, which is really unfortunate. So hopefully like when people get more of like more awareness and education about the disease, which we're trying to do on this podcast. So hopefully people get educated. I think it'll be so much better. Like life will be so much better when people are way more aware and educated. And I think those foundations are really like on the right track of getting that awareness and education out there. It is also sometimes a big challenge to find those organizations that have those supports. So how did you kind of start advocating for yourself or finding these advocacy platforms?
Probably in the very beginning, it was probably just Google and turning to different, and I read through a lot of different sources and I found the things that resonated the most with me were like patient forums, because those were the sources where they said they had the same symptoms with me, whereas my doctors didn't believe me.
Yeah.
And then now I'm on Facebook groups too. And sometimes it's just a little bit of validation when other people share the same, say they also feel badly in the same ways that you do because your doctors told you that you were imagining it, or that's not typical of Sjogren's, when it's actually quite typical when a lot of people complain about these very same things.
Yeah. I think we often forget that doctors are so busy and don't like pay so much attention, and they should. That's their career. You chose to be in that field, but it's hard when you're describing the same symptoms again and again and other people are describing them too, but nobody's making that connection to put two and two together. And I know like I definitely experienced it with my arthritis, is that as I got older, the more that I could just like have the least amount of pain with the least amount of medication was kind of where I drew my line, and that was where I wanted to stay. So even if I was taking pills, but I had more flare-ups than I did on needles, I would stick with the pills. So I feel like we really have to look for where we find our line. And if we can't find it, we really have to advocate for ourselves.
Yeah, because all the medications have bad side effects. So it's really like choosing between like the different evils that affect your life.
Yeah. And Natasha and I both have been on prednisone. We know that. We know that struggle.
Finding a medication that works for you is very difficult. And then like I went through that process of elimination where it took me 3 years to find a medication that actually worked. So then that ended up having like erosions and damage in my joints because like the disease activity was still there and I was just trying a bunch of medications and like nothing worked. So I totally get when you say like prednisone's the only one that actually works. Trying to like, I guess, make that decision like, oh, side effects and all of that. It's really like, do I want my disease activity to kind of progress? And then, or like, do I care about the future side effects that might happen or the present side effects? So I totally like, I get it.
Yeah, I know. I'm testing out different medications. I was on Plaquenil, which works for some people, but didn't quite work for me. So I'm trying out Celsep now. What are you taking?
I'm on the Methotrexate.
Oh, okay.
I've been on that for a while and it worked. So
it worked for you? So that was one of the recommendations my doctor made. Mm-hmm. But I was reading like side effects and it was really scary.
It is a scary drug. I decided very early on, after I did my own Google research on it, that the long-term side effects, I kind of came to terms with them and I said, like if I have if I have fertility issues, okay, like I'm okay with adopting kids. Like I
Mhm.
came to terms with that very quickly and very early on because I knew that being in that scenario, if I hadn't come to terms with it and found out 5-10 years down the line, because I'm always going to be on this medication, that I would screw myself over. Like, you know, I would hurt myself not getting on terms with it now.
Oh, that's so mature to do that so early on, because you guys have
I did that when I was 13 years old.
Oh my God.
Can't relate. Like I've been on, I think it was, I would say 1 year ago ish or 2 years ago, where I found that triple therapy, so Plaquenil, methotrexate, and sulfasalazine together, like
You
helped a
take
lot.
all three?
I take all three, which is insane because I probably take like 6.5 pills a day, and then on the day after methotrexate, 7 pills, and then a subcutaneous injection once a week, and that's what's been working. But recently, like I got a pinky flare up, which is like really weird because I got joint injections for it 2 years ago, and I got it again, and I got joint injections last week. So like there's still those random flares, which kind of confuses me and makes me think like, is this actually working? Like I'm so confused. So I mean, I think it's working because my feet don't hurt anymore, but you know, I feel like as a patient, you always have those like questions. So
Yeah, it's really hard to tell. And then they always tell you it takes like 3 to 6 months for the drugs to start working. So I have no idea if it's working for me yet.
yeah. And then even sometimes you add, for example, like you change your diet and then, or you add exercising to what you're doing. And then you're like, is the exercising like helping more? Are the medications helping more? Is what I'm eating helping more? Like it's so confusing as a patient. I don't know. It's so much to handle.
Yeah, because there's so many variables to keep track of. And then I realized just recently from keeping track that apparently I always get a flare in June and I always get a flare in October. These are just seasonal things I just get no matter what.
Oh, wow.
I have no idea why. Yeah, so now I just try to like not plan anything serious around those time frames. Nothing I can do.
Yeah. So on that note, why don't we talk about what Sjogren's tracker really is?
Oh, okay. So it's so when I was diagnosed and was having a really hard time sort of managing symptoms, was trying to cut down on prednisone, my rheumatologist said, why don't you keep a journal of all your symptoms and all your medication intake and try to find out what's triggering it in your environment so that you could cut those things out instead of having to rely so much on prednisone. So I thought, okay, but I don't know if I was just really not good with notebooks or lazy, but I could never keep up with it. And I also thought it was crazy to then try to flip through a notebook to try to find correlations, that it would be so much easier if I just had it like on an Excel sheet or something like that. So eventually I started keeping track of things on an Excel sheet. And then I just wanted to find a simpler solution. I thought like there must be an app out there that did this. But when I looked, there was nothing that was quite so good and tracked all the things I wanted it to for someone with an autoimmune patient. So then, yeah, I just decided to create my own. And then like I graph different things, like your flares would be the symptom ratings popping up as a spike. And then I also graph when I take my daily medications, like if I'm doing CellCept, I graph it on the bottom as a horizontal line so I could see if over time it's helping me get better, if the symptom rating spikes are getting smaller. Because honestly, I couldn't tell with Plaquenil years ago.
Yeah. And a lot of the times, like, I know I never really tracked my symptoms. Like, I never wrote it down or anything. And it was always just like, when it happens, it happens. Oh, well. And I know like my mom told me sometimes like track what you're like doing. And I probably did like 2 days of tracking and then forgot about it. So I definitely think like having an app on your phone is so convenient to put it in rather than you taking the initiative to create like graphs and charts yourself, which is like so much work. So yeah.
So when I Googled it, there are like YouTube videos teaching you how to graph by hand your symptoms over time. And I thought there was no way I'm doing that. So, yeah.
Yeah, I was gonna say, did you code this app by yourself or like?
No, I hire somebody to do it, but I designed the screens to
Yeah.
tailor around what I wanted and things that I thought the people with my condition will want. And then I hired a developer.
How did you, I'm guessing while you were doing this stuff, were you on your year off from working as an attorney or?
Yes.
Yeah, because like I want to know, like, how did you manage being an attorney in New York, especially? I mean, I'm going off of stereotypes, so I'm assuming you were very busy.
Yes. So I wonder if other people have this problem. So in the beginning, it was kind of, I was just toughing it out, but like toward the end of my practicing as an attorney, I was getting sick so often, and I would just call out sick. I would just use sick days or vacation days sometimes when I didn't feel well, that I thought this is kind of not sustainable or problematic, especially if stress triggers a flare, and if I have to work really long hours and be in stressful situations. I just didn't want to be sick all the time. And I also was thinking it was going to be tricky to keep practicing as an attorney. So I wanted to do something different where I could have more flexibility, but where I could also be more passionate about what I was doing.
Yeah.
So it's just things converging.
So being like that high-powered attorney and working like hard, I'm assuming, not guessing, I'm assuming. Did you at one point think to switch careers or career change before you were even diagnosed?
Oh my God. So before I was diagnosed, it was so bad because I was feeling sick all the time. I was thinking like I didn't know what to do. I was going to potentially have to file for disability, but then nobody would even believe me because they thought it was psychological because I was just so tired. I remember walking back from the subway station, and it was just a 5-minute walk from the subway station to my apartment. And it's just like using all my energy to just walk home to be able to get onto my couch and just be completely like lifeless after that. So like for a while, it was just work and then doing nothing to just recuperate, and then being really stressed out about it, actually.
Yeah. And that
was
didn't
cool.
really give you any work-life balance, like, because all you're doing is spending all your time working, and then you don't have any energy to actually do anything else that you may enjoy.
Yeah, exactly. And I was just trying to get through, making sure I could still do my work, which required me to think and be able to concentrate, which was causing me so much stress because the brain fog, like you make mistakes, but then you can't make mistakes if you're a lawyer. So,
well, I'm glad I didn't take that career path.
but it's a good thing you were diagnosed early. Well,
yeah.
Double-edged sword. It's like good and bad.
Yeah. It factors into almost every decision you make.
I agree. So I have to make it like a late life career change, I think, partly because of this.
Yeah. So what sparked your interest? Like, obviously you had the idea of developing this tracker, but what really sparked interest in taking it that next step and actually putting it on the App Store and getting it out there?
So I don't know. I think maybe it's like a quarter life crisis. I don't know. Or like a third life crisis because I'm in my 30s. So I was thinking I didn't want to be a lawyer for the rest of my life because the work was fine, but it wasn't personally rewarding. I like the concept of creating something, and I was pretty nitpicky about what I wanted, and the apps on the app stores at the time I was looking into didn't quite fit what I wanted. So I thought, you know what, I'm just going to take a chance in life and create something in the way that I want to. And I think that could be really helpful and easy to use for other people with my condition.
It takes a lot of definitely a lot of courage and being motivated to do that, because I know I've had a lot of thoughts of making apps. First of all, I don't know how to code at all. I don't have any contacts to any developers, like nothing, can't even design, but I have an idea of like, I feel like a lot of people take their personal experiences and then based on that, they kind of create an app on what really helped them. There's so many apps and like personal experiences that you go through, and that kind of leads to you wanting to create something to help yourself, but also like help others, which is so cool. And I'm so glad that you've kind of done that. And I know that you want to expand to the Google Play Store. Am I right?
Oh yeah, that hopefully will be ready in July 18th. It'll be on the Google Play Store, the official version. Yeah.
So what made you feel like it needed to, like, why did you think it needed to be super like accessible? I guess like obviously it's important, but why did you kind of say like, okay, it's on the App Store, like why do people now need to have it on the Google Play Store? Like, does that cost money, by the way? I'm just wondering. Like, do you pay to
in terms of development costs, it's like a whole different thing from the iOS. So you have to hire a different developer to build it. So yes, it did. But because actually when I posted on Reddit and social media, people messaged me to be like, when is the Android version coming out? So then I felt like an obligation. And then I did want it to keep it accessible and like not too expensive. Because honestly, one of the things that popped in my head when I was trying to decide on a price point for like premium features was I didn't want to, if this thing could help people, I didn't want to make it so expensive that, you know, that it's an additional financial burden.
Yeah.
I'm probably going to start using this app now because it sounds pretty amazing.
I wanted to ask you, because I heard that you're expanding from like, I know there was a problem before where people felt that it needed to be catered to more autoimmune conditions or something like that. So can you kind of expand on some of the hurdles that you've experienced and why you kind of wanted to like change your app a little bit?
So what a lot of people told me was that because the name was Sjogren's Tracker, they assumed it was only for Sjogren's patients. But then once they tried it out, like all the symptoms you want to track and all the medications, they're customizable. So you could change the name, change the color, whatever you want. So they were telling me that, oh, this really could be used for any autoimmune condition or chronic condition. So why don't you change the name to something different? And then, so I was bouncing around with different name ideas, but eventually I decided to just create a companion app. I'm going to call it Chronic Genie.
Ooh.
And then just do like a different color scheme, but that offers very similar features to the Sjogren's Tracker. Because, so when I was bouncing off the idea on social media of creating a more generic app, some people who have Sjogren's were like, but we like the name because it helps raise awareness. So I do want to keep that component with the original app and just create a companion app that's sort of has similar features that's marketable for broader appeal.
So now it'll be like once the companion app comes out, it'll kind of be like a brother and sister duo, you know, kill
exactly
with.
I referred it to as like a sister app, so it's going to be called Chronic Genie. I'm sorry. Oh yeah, it's Chronic Genie, and then it's going to be like a blue and purple color scheme because it's like a little genie.
I'm excited.
So hopefully that'll be out maybe in August or September, but I'm just doing like one project at a time.
Yeah.
Ooh, I'm excited. Put me down on the wait list.
Awesome. I will.
So before you came out with this app, when did you really start advocating for yourself when you were in the process of being diagnosed with Sjogren's?
I think when I was first diagnosed, I was like so bitter about it because I had complained about these things for years and years, and then people didn't make the connection. And then the more I learned about it from patient forums, how they had all the same symptoms, like I always have sinus infections, and my primary physician or rheumatologist never made anything of it. But when I went to an ENT, he was like, oh yeah, people with Sjogren's have sinus problems all the time. I ended up having to have like surgery to straighten my septum, or like, because it was so swollen on the inside that very little air was getting through. But the ENT doctor knew that people with Sjogren's had sinus infections, sinus problems all the time. And then when I had acid reflux, I went to like gastroenterologist, and he was like, oh yeah, people with Sjogren's have this all the time. But none of my rheumatologists ever said anything about it. So I think I was kind of bitter and sour, and that anger sort of fueled me to advocate for myself. And I just wanted to go on a rant about how there needs to be more awareness.
It's great that you went on this rant. Like it's shown through this app that the rant was worth it. 100%. So you mentioned an ENT. what do you actually think kind of triggered per se your condition? Like, do you have any thoughts of like what you thought was the reason behind you getting this condition? Because like I know I did.
I think maybe two things. So I think I know exactly when I started having the symptoms. It was like second semester of law school. And right before then, I was living by myself and I was like eating really badly. I used to have a donut and like a bottle of Coke for breakfast because I was an adult and I could do whatever I wanted. And I didn't know foods could be bad for your body. So I just ate whatever I wanted and I would just get like fast food. And I had like a fast metabolism. So it looked like I was healthy-ish. So I think I ate really badly and that partly triggered it. And like the second thing, I'm not sure, but it was also around the same time that I started going on birth control pills. I didn't know if the hormone affected, was a trigger for my condition. Mm-hmm. Because people with Sjogren's is like a 10-to-1 ratio of female to male. So they think it might be linked to hormones.
That's interesting.
How about you? I'm actually really curious.
So I actually got strep throat from grade 5 to 7, 4 times a year. And then in grade 7, I went to an ENT and a speech pathologist. This was the end of grade 7, going to grade 8. And he fixed my throat. I basically was coughing and I couldn't sing because I still sing now, but I used to do classical singing training. Uh-huh. And my throat, I could not sing. When I sang, it was just breathy air coming out. It was just weird. Anyways, right after getting my throat fixed, literally what he did, he massaged my throat. I'm telling you, he went like this, and it was gone. I could sing again, but I got arthritis right after. So it was really weird because I never got strep throat again. So I feel like it's something to do with that. And then on top of that, I had I moved from public school to private school. And I feel like that was the most stressful thing ever. So I feel it was definitely stress and then something to do with an infection or something.
I don't have a story. I don't know. Mine is very, very questionable. I don't know why I've been diagnosed. I don't know what went wrong. I think stress and anxiety plays a big part of it. I was quite an anxious kid at school. I went to a school that didn't have many people that look like me. So I stuck out a lot. And I think that was a lot of my childhood. And I always felt that way. So I think that played a part in it. But other than that, I wasn't going through anything when I got diagnosed. So I don't know. We are there's no history of it in my family or anything that we know of.
Oh, that's so strange.
Yeah.
Same.
Yeah.
It's called juvenile idiopathic arthritis because idiopathic means unknown cause. So that's why we can predict the cause. Yeah. Anyway. Yeah.
But I think even the scientific community don't know. They think stress helps trigger it. They think maybe a viral infection can help trigger autoimmune conditions, but they don't really have answers.
Yeah.
It's generally just predictions, and I don't think my doctor hasn't told me that, but I've just made those predictions. So anyways, so this is our last question too, and I hope this gives a lot of information and insight to other people that are watching. What advice would you give to youth when it comes to technology and managing a disease?
When it comes to technology, I would say use it to your advantage because so the way I saw it was that technology gives you the ability to do things in a simpler manner. And whereas with the notebooks, I could never be I was not the type of person that could just spend every day writing in a notebook and flipping through it to look for connections. I needed something that was simple, fast, and easy to use. So to the extent technology can offer you anything that's simpler than what you currently have that helps you with your condition and helps ease your symptoms, take advantage of it and try out different things to see what works for you.
Yeah. Thank you so much for coming on to our podcast today. We really loved hearing about everything you've done and accomplished at such a young age. And, it's an inspiration to Natasha and I. We're still a little, we're still babies. We're not.
No, you guys are so cute. You guys have done so much. I'm like so amazed at what you have done because I'm in my 30s. I'm older.
Natasha's not even in her 20s yet.
Yeah, I'm not. I'm 18, so.
Yeah, you guys are babies. You have like so much potential. You're already doing such a great job, honestly.
Thank you.
So everyone watching this video, check out Ingrid's social media platforms, the app that will be coming out. That'll be super cool to access and it's accessible to many people. For now, you can definitely download Sjogren's Tracker on the App Store, free for all, and track your symptoms. Everyone like, comment, and subscribe, and we'll see you all next week on Take a Pain Check.